Intermittent catheterization. Catheterization is necessary when the bladder does not empty adequately. Inadequate bladder function may be the result of a spinal cord injury, closed bladder exstrophy, which is a congenital malformation of the bladder, a tumor, or myelomeningeal seal, known as spina bifida. Urinary problems occur when the bladder, the sphincter muscle, and/or the neurological signal to and from the brain does not work correctly. Intermittent caths, or CIC, is performed several times a day according to a regular schedule determined by an authorized healthcare provider. The typical schedule is catheterizing every 3 to 4 hours. Clean technique means as germ-free as possible. The authorized healthcare provider usually prescribes catheters for single use. Designated trained staff follows standard precautions and uses non-sterile, non-latex gloves when performing the procedure. Correctly performed CICs can also reduce the risk of urinary tract infections and promote continence. The purpose of CIC is to empty the bladder at appropriate intervals, prevent bladder distension, reduce the risk of bladder infection, remove residual urine, and prevent or reduce incontinence, which causes unwanted odor and skin breakdown. Supplies needed: private bathroom or office to perform procedure and possible diapering, catheter provided by the parent, alcohol-free wipes, typically baby wipes, water-soluble lubricating jelly, either in a separate tube or connected to the catheter itself, a container into which to drain the urine unless draining into a toilet. Cups may be provided. Alcohol-based hand rub to use if there is no facility to wash hands adequately with soap and water. Latex-free gloves. All gloves should be latex-free due to the increased susceptibility to allergy related to latex. Pull-ups or diapers for changing, provided by parent. Procedure instructions for urethral cath for boys. Ensure the child is comfortably positioned, either lying supine or sitting on the toilet. Wash hands with soap and water. Dry or clean with an alcohol-based hand rub. Open catheter package halfway, being careful not to touch the catheter tip. Put on gloves. Gently pull back the child's foreskin if he has one. You will be able to see the urethral opening. Hold penis pointing towards the stomach. Wash the tip of penis starting at the urethral opening and work outwards in a circular motion until an alcohol-free wipe, such as a baby wipe. Place lubricant on the catheter tip. Careful not to put on gloves. Decrease ability to control catheter if gloves are lubricated. If catheter has attached water lubricant, skip this step and pop the lubricant packet in package. Slide the catheter slowly into the opening of the urethra until urine starts to flow. If resistance is felt, stop for a few seconds, then continue. Once urine starts to flow, point the penis and the catheter downwards, draining into a container or toilet. Pull the foreskin gently back over the penis. When urine flow stops, withdraw the catheter slowly. It may start to drain again. Wait until this ceases again, then remove the catheter. This ensures complete emptying. The catheter should be discarded into the trash can and hands washed with soap and water. Procedure demo for boys. Procedure for girls. Ensure the child is comfortably positioned, either lying supine or sitting on the toilet. Wash hands with soap and water and dry, then clean with an alcohol-based hand rub. Open catheter package halfway, being careful not to touch catheter tip. Put on gloves. Gently separate the labia with one hand and wash down from the top to the bottom using an alcohol-free wipe and discard. Repeat with a clean wipe. Place lubricant on the catheter tip. Careful not to put it on gloves, as this can decrease the ability to control the catheter if the gloves are lubricated. If catheter is attached to water lubricant, skip this step and pop the lubricant packet in package. If resistance is felt, gently rotate the catheter a little bit. Once urine is flowing, push the catheter in a few more centimeters to ensure that it is in the bladder. When urine flow stops, withdraw the catheter slowly. It may start to drain again. Wait until this ceases again and then remove catheter. This ensures complete emptying. The catheter should be discarded into the trash bin and hands washed with soap and water. Procedure demo. Review this media for further instructions on a straight cath. Female and male. Problems that require immediate action. Bleeding from the urethra, which could be due to trauma or infection. Discontinue catheterization and contact the nurse. Inability to insert the catheter. Increase sphincter tone due to anxiety or spasm. Encourage the student to relax by breathing deep. Reposition. Try having the student flex at the hips. Recheck catheter placement that is not in the vagina if it's a female. If so, do not reinsert, discard, and use a clean catheter. If you are still unable to perform the procedure, contact the nurse. If there is no urine flow, it could be due to improper placement of the catheter or an empty bladder. Check the position. If no urine flows, contact the school nurse and the parent. If there is cloudy urine, mucus, blood, foul odor, color change, or unusual wetting between catheterizations, consider a possible urinary tract infection. Contact the school nurse and/or parent, and always report any changes in the student's typical pattern or response to procedure. Ensure documentation by documenting the time, the duration, initialing, the quality of the urine, and the student's tolerance to the procedure. Families can find CIC an emotionally difficult procedure when it is first introduced. If a child has significant anxiety, do not force the process. Allowing children to handle equipment, hold the catheter, clean themselves, or assist in placing the catheter, even from the first catheterization, can give them a sense of control. Notify district nurse and parents immediately if any problems should arise. Consider counseling if a student is struggling emotionally. Be open to emotional support. Should student choose to talk about their condition or trouble.